my year on an oncology rotation, so I was kind of thrown into the deep end of confronting medicine. I remember going to see a patient who had lymphoma, and when I started asking about his treatment plans, he said to me, "Oh, there's nothing more they can do." He was a 45-year-old man and he was dying, and it was a really hard moment for me. I suddenly felt like I was an intruder in this man's life and that I didn't have the skills to counsel him through something so profound as end of life. But my advice to you would be to not shy away from an experience like that. It's human nature to be shocked and saddened by death and suffering, and it's okay to feel that way. I think just a bit of silence and some empathy and compassion really goes a long way in those discussions, and it's so important to have those skills as a doctor.
I don't think I will ever forget my first experience of certifying a death with the intern in third year. Even though this was a man who was unwell, old, expected to die, it was very peaceful. The process is a little bit more confronting than you think, and even if you feel like you're not affected, often it does throw you out for the day. So I guess my advice would be to just take some time out, think about it, because death and dying is something that pops up all the time in medicine. So it's important that we have our own structures in place and way of approaching it, accepting it, and then moving on.
I have one encounter that I remember quite vividly from third year that had to do with someone's death. There was a patient who I was asked to go see by another med student or a doctor because they had splenomegaly. And I went up to see him with my ward partner, and he was about 50 years old and he had multiple myeloma. And although he seemed quite tired, he seemed okay and he was quite alert. He's very nice, happy to talk to us, and we did an abdominal exam to palpate his spleen and then thanked him and left. The next day we went back to go see him and found out that he'd actually died the night before. And obviously I was really shocked that this had happened because he didn't seem like he was anywhere near dying when we were talking to him. And I also wondered if we'd done something that had caused him to die, if palpating around his tummy had done something to his spleen. Of course, this is ridiculous. He would have had many people do abdominal exams on him during his admission, but it was still really difficult not to feel like we had done something wrong, and I felt pretty guilty about it. Every medical student has difficult experiences with death and dying, and I certainly know many medical students who have just needed to talk to a friend or find a shoulder to cry on, and I know I've definitely shed some tears in the hospital myself. Having said that, although death unfortunately is an inevitable component of being a doctor, it's also one of the most rewarding parts of the job. Not only do we get to sometimes cure people or make them a little bit more healthy, but we have the privilege of easing suffering and dealing with people when they're at their most vulnerable, and making someone's passing as dignified or special for a family as possible. So don't forget that, and make sure to be as sensitive and mindful as you can during those experiences and reflect.
Okay, so death and dying is always confronting, and it's still confronting for me, and I know for a lot of other people as well. So definitely talk to somebody about how you feel, and the hospital environment is generally quite supportive, and they would usually just debrief you if you're not feeling okay about it. So it's definitely worthwhile talking to someone about it. Okay?
So obviously next year you'll probably have your first experience with death and a dying patient, and I know for me it kind of hit me quite hard. Lucky for me it wasn't very sudden or unexpected, but I think it's important to kind of think about it beforehand and kind of understand yourself a bit. I think you learn quite a bit. As a pretty emotional person myself, I think that's why it hit so hard. But in the end, you have a lot of people around you, a lot of support. The doctors are very helpful when you have your first experience of that. Same with all the site admin staff, all the teaching staff, and of course all your friends in the student common room or wherever, family as well. All good people to talk to and help you work through it. And I think it's an important part that it is that you do have that experience, because it's obviously the profession we're going into. So, I mean, obviously, don't be too afraid of it before it happens. You're just gonna have to kind of work through those feelings and experience that learning for yourself when it happens. And there's plenty of support out there for you to get through as well. Being in the way, it's definitely something which third year is all about. You're pretty much in the way all the time. How to deal with that? Maybe go to the gym a bit, work on your flexibility, do some yoga so you can stretch in and out of the way, duck and move, so play some dodgeball, that definitely helps. But in all seriousness, everyone in the hospital knows that you're there to learn and that it's really important for your learning. So sometimes you might be in the way, but if you offer to help, they're very understanding and they want you to be there, even though sometimes it may not feel
This
like
is
that.
difficult. Try to read the situation. I think sometimes things are busy and hectic and people are running around, and the best thing is just to be able to see when to get out of the way. Although other times there are real opportunities for students to really help out their interns and regs and become a part of the team. So examples are reading out the OBS charts on ward rounds is really useful. Also spending time to go and speak to patients about their family history and past history can really help out the interns and regs when they have some questions.
I think approaching junior doctors will be very helpful for these cases because they probably remember what it's like to be a medical student, and always ask them how it can help. Be polite when you're asking them to help you with something as well, and also the best way is to ask them to let you know if you're actually in the way.
Always coped well with the feeling of being in the way on the ward, because it does happen quite frequently. But I think it's really important to understand as students that you do have a place, and your place is to learn. And all the doctors on the ward have been in your place before. So be curious, be keen, and be engaged on the ward, and they won't ask for any more. But also don't underestimate the healing power of conversations with patients. As a student, you're in this really privileged position to be able to explore the patient's thoughts and feelings around their disease. I had so many experiences last year of walking up to a tired, upset patient, and by the end of the conversation they were smiling and laughing with me, and it was really powerful to see how therapeutic that could be for them. So don't underestimate yourself on the ward either.
I don't exactly know how to cope with the feeling of being in the way. For me, that was always a feeling in the back of my mind, and I always felt guilty about wasting doctors' time when they clearly have so little time and when they're so busy. But I guess it's good to know that they really do want to teach you, and they enjoy teaching, and that's what they're for.
Something that's pretty challenging, and there are no easy answers. I found that as a third year or even a fourth year that I often didn't have any idea what was going on, because third years and fourth years have so many tutes and other teaching opportunities that they need to go to, so they only really go to the ward round in the morning, and they miss a lot of what happens on the ward. So when they turn up the next morning, none of it makes sense. And what I can reassure you is this gets a lot better as you become more senior. So for instance, as a final year, you have much less formal teaching. So you spend more time on the wards, the interns and the residents get to know you a little bit better, and they give you tasks, and then you actually do feel useful. But having said that, even as an intern, I often feel like I'm in the way. The other day, I went to my first MET call as a doctor, and so a MET call is a medical emergency team call where, and it's called when a patient deteriorates or someone's worried about a patient, and what it means is that the MET call team comes and assesses the patient to try and prevent them from deteriorating further. So 3 nurses had called a MET call for a patient, and I walked into the room and they were already working up the patient. They'd measured the patient's vital signs, they'd measured the patient's glucose, and I sort of just stood there in the way and not really knowing what to do. So it is a problem that you'll experience, but it does get better with time.
think clinical is much more interesting, but it's very easy to fall behind if you are not doing learning in your own time, because there's fewer structured tutorials, and then so you are sort of not, and there's no exams in mid-year as well, so you might sort of just fall back behind, and at the end of the year when you need to see the exams you might realize that you don't know as much. So trying to keep up with studying in your normal time would be really
So obviously it's a big transition year, third year. You're going from like a preclinical kind of experience to a clinical one, and it can be quite a change because obviously it's a completely different way of learning things. You're not going to be spoon-fed as much as you were in pre-clin years, and also everything you see and learn in the hospital is a lot more practical. Learning things from a textbook is one way, but learning how things actually have to get done in the real world is very different. So that's always a big change, I think. So just adjusting and seeing how stuff is in the real world compared to the ideal textbook world is very different. So I think
I much preferred the clinical environment. I found that things that I had been incapable of remembering in second year suddenly stuck in my head when I saw a patient with them, and I saw the effects that had on the patient and what was used to treat it. Suddenly I could remember the drugs, and it was just much easier than trying to learn it from a textbook.
I found the transition from non-clinical to clinical really exciting. Trading textbooks for real patients is just great, and you get to appreciate the art of being a doctor. Non-clinical years prepare you really well, so don't feel like you don't know enough, because you do know enough. The hospital environment is pretty different to the university. People are at a hospital to do a job and to help people. So it's not really a student-centric sort of place, and that's okay. It doesn't take too long to get used to that, but don't forget that you do have your network of students around you if you ever feel lost.